All right, welcome everyone. We're excited to have you for community enrichment with Andrea from the Harford County Department of Housing and Community Service. Andrea, can you see the screen okay?
I can.
Perfect. We are ready whenever you're ready.
Okay. Well, my name is Andrea Pamela. I am the Wellness and Health Benefits Program Manager at the Harford County Office on Aging. My team does a variety of things, including planning all of the health and wellness programming in the community for seniors living in senior housing, as well as for seniors attending our senior centers. And in addition, we also run the state health insurance program, otherwise known as SHIP. We assist Medicare beneficiaries with understanding their health insurance, understanding how all of the parts of Medicare work together, how Medicaid works with Medicare, for beneficiaries that are on Medicare regardless of age. So we certainly work with plenty of people in the community that are both under and over the age of 65, depending on their disability status and their eligibility for Medicare. So we are in the midst of Medicare Open Enrollment right now. Annual open enrollment happens every year from October 15th to December 7th. So we are smack dab in the middle. And so this is a great time to do a little education about Medicare, answer any questions that you may have, and hopefully give you a better understanding of your health insurance and how all of the parts and pieces work together. So next slide, please. So we're going to talk about Medicare basics. The different parts of Medicare have letters assigned to them. So we will give a little bit of information about each one of those parts of Medicare so you have a better understanding of what covers what in terms of your health care. Next slide. So Medicare is a federal health insurance program that is administered by the Centers for Medicare and Medicaid Services, otherwise known as CMS. Medicare is for people who are 65 and older, any age and deemed disabled through the Social Security Administration and receive a Social Security disability income, and anyone that has been diagnosed with end-stage renal disease or ALS. Anyone in those three categories can be eligible for Medicare. There are two options when it comes to receiving your Medicare benefits. So option one includes original Medicare, which is Part A and Part B. We will talk a little bit more about those different parts in some subsequent slides, but Medicare Part A is the hospital side of the insurance. This is the portion of the insurance that would cover you if you had an inpatient hospitalization. And Medicare Part B is the major medical portion of Medicare. So this is the part of Medicare that covers regular doctor's visits, preventive care, specialists, lab work, x-rays, MRIs, anything else, rehab, physical rehab, occupational rehab, things of that nature. This is known as traditional Medicare. Everyone has a red, white, and blue card. It lists their effective dates for Medicare A and Medicare B. These dates could be the same or different depending on your circumstance. And it also gives you your Medicare number and your name is on it. These are just paper cards, and they usually come when you first go on Medicare. You can request additional cards if you happen to lose yours or it gets really beat up since it is just paper. If you have Medicare, just Medicare A and B, Medicare is an 80-20 system, which means that Medicare only ever covers 80% of its allowable charges, and it leaves 20%. That 20% can be paid in a variety of ways. The first way would be that it would be paid directly out of your pocket. So you would go to the doctor would submit a bill to Medicare would cover their 80%, and then you would get a bill from your doctor's office, from the lab, from the health center, wherever you went, for 20%, and you would just pay that directly. There are people that choose to do that. Most people do not. So most people will try to look for some additional type of insurance that will help them with that 20%. And so there's a couple of different ways that you can do that. One way is that you have group health insurance through a employer or through a retiree benefit that you might have when you retire. Most commonly, though, people will look for what is called a Medicare supplement or a Medigap. Medigap and Medicare supplement, same thing, interchangeable terms. These are health insurance policies that are provided via private health insurance companies that contract with Medicare. So these policies cover what Medicare covers, and they do not cover what Medicare does not cover, which seems pretty common sense. But the biggest example of this would be vision and dental. So Medicare, traditional Medicare A and B, for the most part, does not cover vision and dental. And therefore a secondary insurance like a Medicare supplement or a Medigap plan, same thing, would also not be covering vision and dental. Things are a little different though when you're looking at group health insurance through an employer, or if you are receiving Medicaid, there could be some additional benefits for things like vision and dental. But in talking about Medicare supplements or Medigap plans, they wouldn't cover those. These secondary insurances, such as a Medicare supplement, Medigap plan, group health insurance, that kind of thing, they would have an additional premium, a separate price that you would pay to have that insurance that would be in addition to paying for your Medicare Part B. And in addition, if you choose to go with a secondary insurance of some kind, you also have to pick up prescription insurance. Prescription insurance is known as Part D, D as in dog. These are also run through private health insurance companies that contract through with Medicare to provide your prescription coverage. These prescription plans have a separate premium depending on the plan, and your needs based on the amount of medications that you take would determine what that premium might be. On average, the current average premium for 2026 for a prescription plan is around $35 a month. There certainly are ones that are less expensive or more expensive. And again, that's kind of determined on how much medication and what type of medication someone is taking. So that's option one. Option two would be to go with what's called a Medicare Advantage plan, also known as Part C, as in cat. A Medicare Advantage plan is a kind of bundled health insurance plan that provides all of your medical benefits to include your prescription coverage under one plan. And these types of plans vary based on your location in terms of what is offered and what isn't. Sometimes these plans have a premium associated with them that would again be in addition to paying for your Part B Medicare. So we will talk a little bit about these different options in more detail, but there are a couple of different ways, a couple of different options that people might choose from when they decide or when they eventually go on to Medicare. Next slide. So applying for Medicare, how does that happen? If you are receiving regular Social Security retirement income, or if you receive railroad retirement benefits, or if you are receiving Social Security disability, you will be automatically enrolled in Medicare. If you are turning 65, your start date for Medicare would be the first of the month that you turn 65. So let's say your 65th birthday is December 15th. Your start date for Medicare would be December 1st of that year. If you are on Social Security disability, there is a 23-month waiting period before Medicare kicks in. And again, Medicare always starts the first of the month that you qualify. And so again, the card would automatically come. You would automatically be signed up for Medicare A and B. When you turn 65, you have a 7-month initial enrollment period. It is the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday to get all of the different parts of Medicare and make sure you're enrolled in everything that you need. So long as you do everything in those 7 months, you do not have to worry about any gaps in coverage or any penalties that could be accrued. And everything will sort of just happen the way that it is supposed to. If you do need to enroll in Medicare on your own because you're not getting any form of Social Security, then you would need to do it in a couple of ways. You can go directly to the Social Security Administration office local to you and have an appointment with one of their counselors who can sit down and actually help you submit that application to be able to start taking Medicare A and B. Social Security is the entity that does all Medicare enrollment and the payment of Medicare. So they are in charge of enrolling you, and they are in charge of taking your premium payment every month for Medicare B. That premium payment, if you are taking Social Security, comes directly out of your Social Security check prior to it being deposited into your bank account each month. If you are not taking Social Security, but you still want to get enrolled in Medicare, you would self-pay for your Medicare Part B premiums on a quarterly basis. And then that would happen either via check or credit card or coming out of your bank account automatically. If you are covered under another form of health insurance, so let's say that you are still working at the time you turn 65, a spouse is still working at the time you turn 65. Let's say that you become eligible for Medicare based on disability, but you have a spouse that is still working. You can choose to waive Medicare Part B and not take it at that time, and not be assessed any kind of penalties, so long as when you eventually take Medicare, you can show documentation that you had credible insurance. Credible insurance is considered any insurance that is equivalent to the coverage of Medicare. So most employer plans are going to count as credible insurance. Things that wouldn't count as credible insurance would be something like you are paying for COBRA through a old employer. That is not considered credible insurance. You would still need to go on Medicare. You also cannot have a health insurance plan through the Maryland Health Connection and Medicare at the same time. So if you have a plan through the Maryland Health Connection and become eligible for Medicare, you will be transitioned to Medicare and taken from the Maryland Health Connection plan. You can't have both. They're both considered government health insurance, and having both would be double dipping. Next slide, please. So in addition to your initial enrollment, which is that 7 months around your 65th birthday, or if you're becoming eligible for Medicare based on being on Social Security disability, you get about a 6-month period of time to get everything signed up for. There are some additional enrollment periods that take place during the year as well. So the second one is called general enrollment. This happens every year between January 1st and March 31st. During this time, you could enroll in Medicare Part A and B if you did not take it during your initial enrollment or when you initially became eligible for Medicare. There are some instances where people choose not to take Medicare. And then if that is the case, they do have to wait until January 1st to March 31st to sign up again. You can also enroll in a Part D prescription plan. If you have a Medicare Advantage plan and decide you don't want to have one anymore, you can get into a Part D plan. And you can also change Medicare Advantage plans during this time if you have a current Medicare Advantage plan that you're unhappy with. So there's a couple of things that you can do during that time frame. If you enroll in Medicare Part A and B during the general enrollment, your coverage will take effect the first of the month after the month you enrolled. So let's say you enrolled January 5th, your coverage would take place February 1st. There is also open enrollment. Open enrollment is what we are in right now, October 15th to December 7th. This happens every year, and this is the time when you can sign up and change your prescription plan, and you could also sign up for and change your Medicare Advantage plan. In order to do any kind of enrollment during this time, you do have to have Medicare Part A and B. So this would not be a time for you to get A and B if you don't already have it. This is only a time for you to change prescription plans and Advantage plans. And then lastly, some people will qualify for a special enrollment period, and this really depends on each person's circumstances. Some people may never get a special enrollment period. Some people could get one a couple of times. It just depends. So some things that count for a special enrollment period would be something such as you retired, you moved out of the state, and your plan is no longer being offered in the state that you moved to. There was the death of a partner who was carrying the insurance, and therefore you no longer have access to that insurance anymore. And something like you lose your insurance under no fault of your own. So let's say that you have a supplemental policy for Medicare and that company contacts you to let you know that they're no longer offering insurance in your area, that would count as losing your insurance under no fault of your own and would allow you a special enrollment to go and get new insurance. During a special enrollment, you could enroll in Medicare Part A and B. You can get a prescription plan. You could get a Medicare supplement, and you could also look for a Medicare Advantage plan. So a lot of times we will get folks who will contact us in need of insurance. And if they aren't fitting into one of these enrollment periods, that is an issue. You can't just sign up for things at any point during the year, but we do our best to try to help people navigate this process if they're trying to get insurance outside one of those enrollment periods. There are some circumstances that might come into play based on income where you might have a little wiggle room. But for the most part, this is when you can enroll in different things. Next slide, please. So as I mentioned before, we're going to talk a little bit more about the different parts to just give you an idea of costs and such. So Medicare Part A, again, this is the hospital side of the insurance. This covers you if you have an inpatient hospitalization, if you end up in a skilled nursing facility after a hospitalization. So let's say you go into the hospital and you have to get a knee replacement and it's unsafe for someone to be released to their home afterwards. They could end up in a skilled nursing facility or rehab center for a period of time afterwards, and Medicare Part A would cover that. Hospice care is covered under Medicare Part A, and home health care as prescribed by a physician. So this is not general home health care, such as help with chores or bathing or food prep, something of that nature. This is home health care, such as a nurse coming in to do wound care a couple of times a week for a period of time. It has to be ordered by a doctor. It has a finite period of time that it happens. So there's a definitive beginning and end to this type of health care. For most people, the premium for Medicare Part A will be $0, so long as you've worked at least 10 years and paid Social Security tax. You will not pay a premium for Medicare Part A. If you have not worked enough years and paid into taxes, there is a cost. Medicare Part A premium for 2025 was around $542 a month. That can be prorated based on your number of working quarters. So you may pay less than that, but still pay. However, if you are someone who does not have the work history but is married, you can draw off of a spouse's work record in order to get Medicare Part A for no cost. Some children who are considered dependents or adult children considered dependents can draw off of a parent's work history in order to get Medicare Part A. But I would say most people don't pay for it. Medicare Part B, again, is that main source of health insurance under Medicare. It's going to cover services from doctors and healthcare providers, both primary and specialists, outpatient care in a hospital, home health care, again, could also go through this, but again, it's that definitive home health care, durable medical equipment, and preventive services like mammograms and colonoscopies and flu shots and such, pneumonia shots and stuff can go through Medicare Part B. Medicare Part B does have a monthly premium. Everyone pays this monthly premium. Either they pay it themselves out of, as I mentioned, it comes out of that Social Security check directly, or depending on income, if someone qualifies for a Medicaid program that would cover Medicare Part B premium, it might be paid that way. For 2025, the Medicare Part B premium was $185 a month. For 2026, the Medicare Part B premium is going up to $206.50 a month. And again, that comes right out of the Social Security check. Medicare Part C are the Medicare Advantage plans. They are a bundled package, includes your Part A, B, and prescription benefits. They do typically have a premium. There are some plans that don't, but there are some plans that do. I would say an average premium for Medicare Part C might be around $50 a month, and that is on top of your Part B premium. So you don't pay it in place of Part B, you pay Part B and Part C. The thing that is important to remember with a Medicare Advantage plan is that when you sign up for the Medicare Advantage plan, it actually becomes your primary health insurance and Medicare becomes your secondary. And so if you do not follow the rules set in place by the Advantage plan, If they don't pay for something, Medicare doesn't come in and pay the 80%. Nobody pays. So it is important if you get an Advantage plan to make sure that you understand the plan and exactly how it works so that you don't inadvertently cost yourself a bill that could have been paid. And then Medicare Part D, again, prescription plans. These are run by the private health insurance companies. They follow the rules set by Medicare. You would pay a premium for these as well. There are a couple of plans at $0. There's a couple of plans at $4 and so on and so forth. This helps cover your medications. The plan dictates what you pay for those medications based on the type of medication that you're taking. So these are the basics as far as the different parts and what you would put together to make one complete package, depending on which option you chose. Next slide, please. So this is a little bit more detail about these different parts. Again, both Medicare Part A and B are an 80-20 system. They pay 80%, they leave that 20% to be picked up via another form of insurance, the Advantage plan, or a group health insurance if you had that. Medicare Part A does have a deductible associated with it. A deductible is the amount of money that an insurance company says you have to pay before they start to pay. So for Medicare Part A, the deductible per hospital admission for 2026 is $1,716. So a couple of things to know about that. If you have a Medicare supplement, if you have Medicaid, if you have a group health insurance policy, if you have a Medicare Advantage plan, you may not necessarily pay this deductible outright or totally. It depends on the plan. But if you only had Medicare A and B, you would pay this. It is per hospital admission, which means if you have multiple admissions in a year, you would pay this deductible each time. And once it is paid, then Medicare would kick in paying the 80-20, or your Medicare Advantage plan kicks in to pay what it has determined it will pay. You can be assessed a penalty if you do not sign up for Medicare Part A when you initially are eligible for Medicare, same as Medicare Part B. And I'll talk about the penalty when we get to Part B. Medicare Part B, again, has that monthly premium for 2026 of $206.50, and it also has a deductible. This deductible is $233 for the year. So most people, if they go to the doctor a couple times in January or once in January, February, they usually have met this deductible. Most people will pay the Medicare Part B deductible out of their pocket unless they have Medicaid going along with their Medicare. But if they have a supplemental policy or potentially an Advantage plan, they will probably pay a portion of this deductible. Again, you can get a penalty for not signing up for Medicare Part B when you are initially eligible for Medicare. As with Part A, Part B, same. There is a 10%. The penalty is there's a formula that they use. So for every full 12 months that you go without having Part B, when you should have had Part B, the penalty is 10% of the current monthly premium. So for 2026, if you were to go the full year of 2026 without having Medicare, you would be assessed a penalty of $20.65. That $20.65 would be added on to the monthly premium each month once you sign up for Medicare. And it is lifelong. So if you accrue a penalty, it will not go away. You will just pay it for the rest of the time that you're on Medicare. If you choose to waive Medicare Part B because you have another form of insurance and you can show documentation of that when you go to sign up for Medicare eventually, you will not get a penalty. The penalty is only assessed to folks who just choose not to take Medicare Part B, and that does happen sometimes because of the cost, but then later go back and need it. There are not a lot of people that get this penalty, but some people do, depending. There can be some circumstances and when people, just don't take Medicare Part A or B when they should. Medicare Part D, which is the prescription insurance, again, the premium varies by plan. There is a deductible associated with prescription plans. For 2026, it is $615 for the year. The prescription plans work a little bit differently when it comes to the deductible, so we can talk about that in some subsequent slides. But there is also a penalty that you can be assessed for not having prescription insurance. So this penalty is a little bit different. It is 1% of the current average premium for the year for every month that a beneficiary does not have a prescription plan but should have and did not have any other form of prescription insurance. So if you were to go a whole year without prescription insurance, you would have a 12% penalty at the end of the year. The average premium for 2026 is $35. So you'd have 12% of $35, which is roughly about $4 or $5. And that would be added on to your prescription plan premium each month after you sign up for one. Again, it is lifelong, doesn't go away. So it's best to avoid these penalties so you don't inadvertently end up costing yourself more money for your health insurance than need be. Part C, Advantage plans, premium depends on the plan, deductible depends on the plan, but there is no penalty because this is just something that you would choose. If you have one or don't have one, is up to you. They don't penalize you. Next slide, please. A little bit more about Medicare supplemental insurance, also known as Medigap policies. Again, as I mentioned before, these are private health insurance policies that supplement original Medicare. You do have to have Medicare A and B in order to be eligible for a Medigap or a Medicare supplement. They help cover the 20% that original Medicare doesn't cover. Medicare pays its share, then the bill goes to your supplement pays its share. A Medigap policy covers one person. So unlike in the private insurance industry when people worked and you had a policy that might have covered your entire family, once you transition onto Medicare, it is a single person policy. So everything that you add to it is just for one person. Now, that's not to say that if you're a husband and wife or partners or whatever, that you may not choose the same things, but technically they would be separate policies that you would pay for separately. There is an additional premium for Medigap policy. You pay it in addition to your Part B premium. The Medigap supplemental insurance is changes prices about every 6 months. They kind of do put out the new price guide. The price guide is available on the Maryland Insurance Administration's website, and they do price adjustments in July and January. They give you kind of an average of what those policies may cost. There is a birthday rule that was passed in the state of Maryland in July of 2023, which says that if you already have a Medicare supplemental policy, you can call your company, call other companies each year for the 30 days after your birthday and shop the policies and see if you can get a better price on your policy. So if you notice when we talked about those enrollment periods several slides back, there wasn't specifically an enrollment period that talked about looking for supplemental insurance or switching insurance. It is difficult to change Medicare supplemental insurance because when you first go on to Medicare is really the best time to get this type of insurance. Reason being, when you first become eligible for Medicare and you start to look at these types of supplemental insurance policies, the companies cannot put you through what's called medical underwriting, which means they can't ask you any health questions and they can't base your cost of your coverage or your coverage on your answer to those questions. Once you get outside of that initial enrollment period onto Medicare, if you start to look for a supplemental insurance policy at that point, they are going to put you through medical underwriting. They will ask you a series of health-related questions, and based on your answer to those questions can determine a few things. It can determine the cost of the policy. It can determine whether the insurance company even chooses to cover you with a plan. And it can determine different types of regulations they may put on your policy. So they could decide they'll cover you, but they won't cover anything to do with this specific health issue for 6 months. So you really don't want to get into a situation where your health or the medications that you're taking will determine the cost. You want to be able to get the most competitive cost possible. So there isn't really an enrollment period specific to these types of supplemental insurance. And in the past, because of that, once people got a supplemental policy, they were sort of stuck with it. And the cost, as with any health insurance or insurance in general, would continue to rise over the years. What this birthday rule did back in 2023 is it helped to sort of level that field again, so that for people who maybe had had a supplemental policy for 5 or 6 or 7 years and it had continued to rise in cost, it allowed them to get a more competitive price again without going through that underwriting. So again, no health questions could be asked during this 30-day period. So for most people who feel like their supplemental insurance has gotten really pricey and they call us, we usually always suggest that they wait until those 30 days after their birthday so that they don't have to answer those health questions and they can see if their current company can give them a better price, or they can go to another company and get a better price. You cannot use the birthday rule to get a supplemental policy if you've never had one before. And you can't use the birthday rule to get a better policy. You can get the same policy or a policy with a little less coverage, but you can't upgrade your policy. It is still very helpful, the birthday rule. It has helped a lot of people save money. It has helped a lot of people make some changes to their health insurance that they otherwise wouldn't have been able to. Next slide, please. Medicare Advantage plans, again, this is Part C. If you join a Medicare Advantage plan, you still have all the rights and protections of regular Medicare. You still get all the services covered by regular Medicare Part A and B, but the Advantage plan may cover those differently. So what that looks like is, instead of that 80-20 system that Medicare A and B has in place, a Medicare Advantage plan may say, we are going to charge you a copay or a co-insurance for those health services, and you're going to pay that up front when you have those done, and then we're going to cover the rest. In some circumstances, that copay or co-insurance may be less than the 20% that you would have paid if you only had regular Medicare. In some circumstances, it might be more. It just depends on what you're having done. So many times with Medicare Advantage plans, they may say, well, if you go to the primary care doctor, you don't pay anything. It's free. But if you go to a specialist, your copay is $40. So what that looks like is you show up at the specialist, you go check in, and then you pay the $40 right then and there. And then that's it. That was your portion of that particular visit. Or it may look like you going to have an MRI, and the MRI is going to be $200, and that's your share. Maybe the $200 in regular, Medicare A and B traditionally would have been less, but with the plan, they're telling you your copay is $200. So what you're doing is cost sharing with the Advantage plan. You're paying some, they're paying some. Where you do start to see the costs get a little higher with Advantage plans is when you start to get into things like hospitalizations or going into some type of rehab after a hospitalization. Many times, those costs do tend to be higher. Your share tends to be a little higher in those circumstances. Advantage plans many times will include your prescription coverage, and there is usually an out-of-pocket max that these Advantage plans have in place. So what that might look like is you sign up for an Advantage plan, and the Advantage plan says that your out-of-pocket max is $6,000 for the year. And what that means is that if you end up paying out of pocket for the year $6,000, and that $6,000 can be made up of those copays, co-insurances, and such. Once you've hit the $6,000, your plan covers everything at 100% for the rest of the year. It does allow for a little bit of a safety net for folks who could potentially have a really catastrophic year of health needs, that they know that at the end of the day, they're not going to spend more than $6,000. It's not to say that's not a lot of money, because it certainly is, but if you only had Medicare A and B, there is no out-of-pocket max. So if you had a really catastrophic year health-wise, that 20% will just keep accruing and accruing throughout the year and could amount to $50,000. So these Advantage plans do offer you a little bit of protection in that particular arena as far as how much you'll spend as a bottom line at the end of the year. Certainly, many times people don't go anywhere near that out-of-pocket max, but it is there kind of as a safety net. These Advantage plans also include extra benefits such as vision and dental. They may also include some transportation. Some of them include amount of money that you can spend on over-the-counter products each quarter. It just depends on the plan and what they're willing to offer their beneficiaries. You cannot and you really would not want to have a Medicare supplement and an Advantage plan at the same time, because you would be paying for too much insurance at that point. Because of coordination of benefits, inadvertently, there would most likely be your supplement that would never actually pay for anything. So, you don't want to overinsure yourself to the point where you're putting out a lot of money in premiums that aren't really doing anything for you. The other thing to keep in mind with Advantage plans is that depending on whether the plan is an HMO or a PPO will determine how closely you have to stay within their coverage network in order for your healthcare to be covered. So if it is an HMO, that means that you can only go to doctors within their network and facilities, hospitals, labs, and such, for them to cover that care. If you go out of network, they're not going to pay anything. And as I mentioned before, Medicare is not going to pay anything. If you have a PPO, many times they will offer you flexibility to go in and out of their network. However, if you go out of network, you are going to pay more for those services than if you use a doctor in network. So prior to folks signing up for these types of plans, we always try to do our due diligence to make sure that their doctors are included in these plans so that they don't end up at a doctor's appointment and find out, in the 11th hour that their doctor doesn't take the insurance, especially a specialist who may have taken you a long time to get in with. The other thing about Advantage plans is that they are very specific to zip code. So what we have available in Harford County is not the same as what we have in Baltimore County, the city, Anne Arundel County. Every county's Advantage plan options are different. So it can be difficult. There's a lot of commercials this time of year for Advantage plans that sound really great, but they may not even necessarily be available in our area. So it's not sort of one plan that fits everybody. You do really need to specifically look at what is available in your area, and of those plans, which ones your doctors take. Next slide, please. So just to compare your options, and this would be specific to each person, but this kind of gives you an idea of the differences between going with an Advantage plan and a supplement Medigap policy. It's broken down by cost, provider choice, considerations. Is there prescription coverage included? This is really specific to each person, because depending on your health, depending on how often you go to the doctor, depending on your budget, will really determine what you can and can't look at in terms of something to go along with your Medicare A and B. So, you are welcome to read through the slide and get an idea of, what this looks like. I will say, just in general, what we usually tell folks is, again, keep in mind that if you don't take a Medicare supplemental policy when you first go on to Medicare, it can be difficult to get one later, especially if you have a lot of health issues. However, if your budget doesn't allow an additional premium of $150 to $200 a month, then this isn't really an option for you. And so maybe you are looking at Advantage plans. If you see a lot of healthcare providers, if you've been with your healthcare provider for a really long time, if you have a chronic illness that requires you to see a very specialized specialist, an Advantage plan might not be a great option for you, because maybe your specialist isn't in any of the plan networks and you're not willing to switch doctors. In that case, being able to have a supplemental policy that has no network, you can see any doctor you want so long as they take Medicare, might be a better option for you, just to have that peace of mind and ease of use. So those types of things are all going to come into play when it comes to determining what type of plan that you want in addition to your Medicare A and B. It's kind of a personal choice. It's going to be specific to each person, but this at least gives you the differences between the plans and why somebody would choose one versus the other. We do have a video on our website, harfordcountymd.gov. If you go to our website and type Medicare into the search engine, a list of options will come up. I believe it's the third one down, says online learning library. And we do have a video that specifically talks about supplements versus Advantage plans. So if that's where you're at, in trying to make that determination, or you're just interested in more information, that's a good video to watch just to get a little bit more information about those two topics specifically. Next slide, please. Medicare does have some Medicaid-based programming that works alongside of it. And this chart here just gives you an idea of what the specific programs are. So in terms of Medicaid itself, there are two programs that specifically go along with Medicare. The first one is called the Qualified Medicare Beneficiary Program. It's sometimes shortened to QMB. This particular program is both income and asset based, so you do have to meet both qualifications in order to be eligible for QMB. If you are eligible, this program almost works like a Medicare supplement. It pays your Part A premium if you happen to have one. It pays your Medicare Part B premium. It covers all deductibles with both Medicare Part A and B, and it covers the 20% that Medicare doesn't cover. It does not cover prescriptions because Medicare A and B doesn't cover prescriptions. In most cases, there are some circumstances in where medications are covered under one of those two options. It doesn't cover vision and dental because Medicare doesn't cover vision and dental. This is a paper application. The application is available online, but you do have to print it out and fill it out, and then you can take it to your local Department of Social Services for them to process it. You can also apply for this program via the My Benefits website. And if you do that electronic application, it actually screens you for all of the programming, including SNAP and full medical assistance and so on and so forth. So if you thought you might be eligible for more things, you could go that route and find out all at one time. There is another, if you aren't eligible for QMB, you could be eligible for a program called SLIMB, which stands for Specified Low Income Medicare Beneficiary. This program pays for your Part B Medicare premium only. So it doesn't cover any deductibles. It doesn't cover the 20%. It only covers the Medicare Part B premium, which is still helpful, saves you $206 a month. It is the same application as the QMB application. So you can apply for both through that same application. The next program is specific to extra help into prescriptions. It's called Extra Help. It's administered by the Social Security Administration. The Extra Help program, if again, income and asset based, you have to meet both qualifications in order to be eligible. This program will pay all or a part of the monthly Part D prescription premium, and it reduces your cost of your actual medication. So if you qualify for the Extra Help program, not only will it cover that premium for you, but it will keep your medications anywhere between about $5 and $12 per prescription each time you fill it, depending on what the prescription is. This is an online application. You can access it via the Social Security website. So if you go to ssa.gov and in their search engine, you type Extra Help, the application will come up. It's pretty simple, easy. You submit it right online, and usually within 2-3 weeks or so, you'll get a letter back letting you know that you received it if you qualify. And then last but not least, we do have a state prescription drug assistance program. It's called SPDAP. It's shortened to SPDAP. This is through the state of Maryland. It is a paper application. They do have a website. You can access the application via there. It does have to be printed and mailed. So this particular program is income based only. They do not take any assets into account. Assets, I guess I should say, are things like savings accounts, investments, property that you own but do not live in, that sort of thing. So this particular program through the state does not take your assets into account. It does have a slightly higher income limit as well. A lot of people will qualify for this. This program pays up to $75 a month for your prescription plan premium. So if your plan has a premium less than $75, the state program covers the whole premium. If it's over 75, it covers the 75 and you just pay the difference. It will pay the premium for your prescription plan, whether you have a standalone plan or a plan through a Medicare Advantage. So it can still be a pretty helpful program. There are many people that access this assistance every year. You can apply at any time. There's no specific time to apply for any of these. If you realize you qualify, you can put an application in. Next slide, please. Real quick about open enrollment. So again, I discussed it's October 15th to December 7th. This is when you would want to look at your prescription plans, look at your Advantage plans, make sure that if there are any changes taking place for the following year, that they still benefit you. If they don't, then you can look at new plans. All changes made to any benefits. So if you decide to switch, everything becomes effective January 1st. So your current plan takes you through the end of the year, and then the new plan would pick up. If you choose to not make any changes, then everything just keeps rolling along as it was. Next slide. Again, Medicare open enrollment, you do have to have Medicare A and B in order to participate and get a prescription plan, get an Advantage plan, make those changes. You cannot enroll in Medicare A and B during open enrollment unless open enrollment happens to coincide with your initial enrollment, which does happen sometimes. Medicare prescription plans and Advantage plans make changes every year to their plans. So it is really important to review your current plan and make sure that nothing is changing that is going to be detrimental to you for the following years in terms of coverage or cost. So these plans will change their premiums, they'll change what they're covering, they'll change what tier their medications are on, which affects the cost. Most plans, all plans should send you a kind of like an explanation of benefits, and it's annual notice of change is what it's called. It is a booklet that they send out that explains to you all the changes that are happening and anything that might be affecting you. So everyone at this point, if you're already on Medicare, should have received this information from your current plan. But we always encourage folks to look at plans, look at their current plan, make sure everything is still going to work, because there's nothing worse than starting the new year and then getting to the pharmacy and realizing, wait a minute, my medication isn't covered, or getting to the doctor and realizing that they no longer take your Advantage plan. So reviewing it now, and you have until December 7th, is a good idea. Next slide, please. There is a tool if you feel like you're computer savvy. It is an easy tool to use on the Medicare.gov website called the Plan Finder. In order to get to it, we always encourage people to actually type Medicare.gov into their search engine so they don't inadvertently get into some type of ad or a personal website for an insurance company. So if you go to Medicare.gov, then when you get to the main screen, you will scroll down, you'll see these 4 little boxes across the screen, and you would click on the second one that says Find Health and Drug Plans. Once you click there, it's going to start asking you a series of questions. Your zip code, what you're looking for, be it a prescription plan or an Advantage plan. Then it'll start to ask you to put your medications in and choose your pharmacies. And then from there, it will give you the prescription plan or Advantage plan information. Couple of things. You can also choose to create a Medicare account if you don't already have one. If you create an account, it will actually have all of your prescription information in it because it pulls any of the most recent things that you've filled. It shows you what your current insurance is, and it just kind of eases the process a little bit, but it's not necessary. The other thing is that once you have put all of your information in and you're looking at the plans, the way that the software works is that it gives you the plans in order of least expensive to most expensive based on the medications that you included. So what comes up first should be one of the lesser expensive plans for you. And as you go down the list, they'll get more expensive. So just kind of give you an idea of how you would be looking at that information. Next slide, please. So real quick here at the end, just want to go over a couple of updates and changes for Medicare for 2026. Next slide. So for 2026, we are going to see the first 10 medications that began getting negotiated back in 2024 are going to finally hit the market with those costs. So Medicare has been put a first list of 10 medications together about 2 years ago, and they have been working with the pharmaceutical companies to negotiate those prices themselves. And this is the list of the first ones that we will see. So if you kind of look through this list, next to it, it says what it's for. Certainly Eliquis, that's a very popular medication that is expensive. A couple of diabetic medications on there, couple of heart medication, that kind of thing. So certainly this will be helpful to folks to be able to get some relief on the cost of some of these medications that have notoriously been more expensive. Every year we'll start to see another list of 10 that will hit the market. So, hopefully some of these medications that are highly prescribed but very expensive we'll start to see be a little bit more competitively priced. Next slide, please. The second change is actually something that started this year. So in 2025, Medicare put a cap on out-of-pocket spending on prescriptions. For 2025, it was $2,000. For 2026, it'll be $2,100. So basically what this looks like is that for Medicare beneficiaries who are taking a lot of medication or several really expensive medications, what this change says is that once that beneficiary has spent $2,000 out of pocket on their medications, wherever that falls in the year, let's say that falls in June, that for the rest of the year, they would pay nothing for their medications. It's almost like a deductible. So once you hit that amount, then your plan's going to take care of everything. The $2,100 includes your deductibles, co-pays, and co-insurances for your prescriptions. In order for this to be effective, though, all the prescriptions do have to be on the formulary for your plan. So if you have a medication that's not being covered by your plan, regardless of what you're paying for it, it's not going to affect that $2,100. It is important to look at and because of this, it is really important to look at that annual notice of change that your plan sends you to make sure that all of your medications are being included on their formulary, which is the list of medications that they cover, because you don't want to have a really expensive medication and be paying for it and never get to have the benefit of that $2,100 out-of-pocket spending. You should easily be able to have that information from your plan and know that everything is covered. Next slide, please. The other continuing change that is happening for 2026, again, started in 2025. I can't say that a lot of people took advantage of this year, but it is continuing on for next year. So they are calling it prescription plan smoothing. So basically, in a nutshell, what this is that for folks who are going to hit that out-of-pocket max, so they're going to spend that $2,100, they have the option of doing what is called a prescription plan payment plan, in which they would take that $2,100 and spread it evenly over the 12 months of the year. So instead of going to the pharmacy in January, February, and potentially paying high costs for your medications because you're trying to meet your deductible, this would allow you to take that $2,100 and divide it evenly over 12 months so that you have a pretty solid payment that you're paying every month that's not going to fluctuate. If people choose to join the payment plan, they actually pay that payment to their prescription plan. And when they go to the pharmacy, they just pick up their prescriptions. They don't actually pay the pharmacy. So this is specific to people who, again, would prefer to kind of have a budget. I've been comparing it to like budget billing with BG&E. So it's almost like that, where, maybe you would have spent less, at certain times during the year, but this allows you to be able to budget your money a little bit better and know that you're not going to show up at the pharmacy and have a huge bill. Next slide, please. And last but not least, we always try to talk about fraud at all of our programs and educational programs that we do because it is so important, especially this time of year. So much advertisement, solicitation, mail coming for advantage plans, prescription plans, health insurance in general. And so this is just a really good time to remember that Medicare, Social Security are never going to call you. If they need to get a hold of you, they will write you a letter. And if they are going to call you, they will let you know in writing that that's going to happen. If someone calls from and says they're from Medicare or Social Security, they are not going to ask for your Medicare number or Social Security number because they have that information. So if someone calls and starts asking for that, you should immediately have a red flag. Anytime somebody calls and offers you something for free in exchange for personal information should be a red flag. If it seems shady, it probably is shady. And even if it's not, you should still, be vigilant that you're not giving personal information over the phone that could inadvertently come back and, cause you to have to owe money or get into a big tangle of a mess. Next slide, please. Quickly before the end here, if you do find yourself involved in some sort of fraud or some type of situation in which you feel like you inadvertently have given out personal information, and it does happen. Sometimes it's you're just not sure. You can call 1-800-Medicare and report it. You can call other health insurance companies you might be affiliated with and report it to them so that they can be on the lookout. Certainly, contact the Office of the Inspector General takes those reports. You can call any SHIP program in any county and make those reports as well. And that way, you can get a red flag put onto your accounts to let them know that you think, that you may have fraud, and that they can be on the lookout for that type of thing. So that is the end of my program for today. I do think I saw at least one question in the comments. So I'm happy to answer any of those or anything else.
Andrea, that was incredible. Thank you so much for giving us so much information. I think we can definitely use this internally as well. This is incredible. There is one comment, and it's, can you switch from Advantage to supplement without going through underwriting?
No. So if you choose to take an Advantage plan when you first go on to Medicare, and let's say you're on it for a year and then realize that it's not a good fit for you. If you go searching for supplements at that time, you will go through underwriting. So, if people are on the fence sometimes, and again, if their budget allows and they aren't sure, I usually say to start with the supplement. And if you realize that that's not great, go to the Advantage plan because there's not going to be any